manuscript that's we're publishing will go over a general concept on how to look at valve disease and the changes in the natural history and the changes in interventions. But then we'll be going into each specific valve problem and outline in detail what one needs to look for in these patients and when we should be considering intervention. In addition, we'll also talk about the newer interventions. For instance, in surgery, not only can we do valve replacement, but we can do valve repair with a much better outcome. Catheter-based therapy is rapidly advancing now, allowing us to treat these patients what we call non-invasively.
This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.